DSW 2310. Pharmacology, Chapter 14. Medications. We need to ensure that the treatment plan and the medications are appropriate. We need to research and find the side effects of the medication prescribed. We should be very concerned about medications we give to people with developmental disabilities. Any new drug in Canada is only approved after extensive research is conducted into the effects of the drug on people without disabilities. There is no requirement for research to be done with people who have developmental disabilities, yet the new drug is prescribed for them. A well-constructed drug study will examine how the drug is changing behavioral symptoms, affecting vegetative functions such as eating and sleeping, affecting emotions, affecting cognitive abilities. Psychoactive drugs to control behavior. Research to date is limited and not well conducted to determine how effective medications are in decreasing symptoms of mental illness in persons with a dual diagnosis. Antipsychotics. Commonly prescribed. Studies do not indicate that antipsychotic medication works for the treatment of aggression for people with a dual diagnosis. Study in 2008. People taking a placebo drug resulted in a decreased number of behavioral symptoms, more than those taking antipsychotics. Outcome. Should no longer be regarded as a satisfactory form of care as a routine prescription. Another study stated that antipsychotics impact social skills and learning. Outcome. Antipsychotics can make the situation worse. Anticonvulsants. There is no high-quality evidence which indicates that anticonvulsants are effective with aggression. Antidepressants. Some studies showed that it works. Others stated the problem behaviors worsened. An extensive study showed that less than 50% of the cases showed improvement in self-injury and not aggression. Guidelines for drug therapy. Treat the disorder, not the behavior. Ensure person has a psychiatric diagnosis. Use evidence-based practices for medication management for the specific diagnosis. Medications are one part of a complete treatment plan. The right drug does not fix the wrong environment. Assess and deal with the environmental, psychosocial issues first. Guidelines for drug therapy. First, do no harm. Do not use a cure that is worse than the disease. Each person has their own definition of quality of life. Medication can impact quality of life due to side effects. Start with low dosages and increase slowly. Remember, the common error of over-prescribing antipsychotic medications and under-prescribing antidepressant medications, poor diagnostic techniques, lack of knowledge that people with developmental disabilities can have mood disorders. Psychotropic drug therapy is not a second-line intervention. In some cases, medication should be utilized first, so a person can participate in treatment. Guidelines for drug therapy. Start with low dosages and increase slowly. A drug withdrawal program is not an automatic feature of drug therapy. Must look at what person requires for ongoing treatment. Keep medication regimes as simple as possible. In general, use of newer antipsychotic and antidepressant medications is preferred. Use the same or lower maintenance and maximum dosages as in individuals without developmental disabilities. Use polypharmacy with caution and avoid, if possible, more than one drug with the same therapeutic effect. Standard process to use with drug therapy. Obtain informed consent. Conduct a thorough medical investigation before initiating the use of medication. Assess for the presence of psychiatric diagnoses. Develop objective outcomes for measuring the effect of the drug, efficacy. Monitor for side effects of the medication. Monitor for under-medication, low levels, not therapeutic. Monitor for over-medication, side effects, toxicity, Don't change drug therapy too rapidly. Don't overuse PRNs. Requires protocol. Have a definite time limit for re-evaluating the drug therapy. Rigorous data collection. Observe and record the following symptoms: pseudo-Parkinsonism, loss of facial expression, drooling, tremors, slow body movements. Akathisia, agitated restlessness, pacing, rocking, shifting positions. Tardive dyskinesia, involuntary muscle movements, limbs, face, arms, legs. DSW, DSP should ensure the following steps. Know the person's current medical conditions, current medications, and past medical history. Be informed about possible side effects, contraindications, adverse effects, food and recreational drug interactions, conditions such as pregnancy, illnesses, etc. that could affect medication. Monitor and evaluate consistently.